CEA test results. What to do if your CEA is high. The carcinoembryonic antigen test measures a protein in your blood that can be higher in certain cancers, especially colorectal cancer. If your test shows high levels, it does not automatically mean you have cancer, but it does call for further investigation. Understanding what this means is crucial for your health. First, let's talk about what a high CEA level indicates. Normally, CEA is produced in very low amounts in adults. Elevated levels can suggest the presence of cancer, particularly colorectal cancer, but they can also rise due to non-cancerous conditions. These include inflammatory bowel diseases like ulcerative colitis, pancreatitis, liver disease, smoking, infections, or even other cancers such as breast or lung cancer. Normal CEA levels vary. For non-smokers, it's usually less than 2.5 to 3 nanograms per milliliter, while for smokers, it can be up to 5 nanograms per milliliter. If your levels are above these, they may be considered elevated. Moderate elevations, like between 5 and 10 nanograms per milliliter, might suggest localized cancer or other conditions. Very high levels, above 20 nanograms per milliliter, could indicate that cancer has spread, but there are exceptions. Some patients with advanced colon cancer may still have normal CEA levels, so this test alone cannot confirm a diagnosis. Next, it's important to contextualize your results. Since CEA can be elevated for many reasons, your doctor will look at your results alongside your symptoms, medical history, and risk factors. If you smoke, your baseline CEA might be higher, so quitting smoking and retesting may be recommended. Your doctor might also suggest repeating the CEA test over time to observe any trends, as rising levels can be more indicative of cancer progression or recurrence than a single measurement. If your CEA levels are high, your doctor will likely recommend additional diagnostic procedures. These may include a colonoscopy to directly visualize the colon and rectum, imaging studies like CORT scans or MRIs to check for tumors or metastases, and possibly a biopsy of any suspicious areas. If colon cancer is diagnosed, CEA levels can help in staging the disease and planning treatment, but they are not used alone for diagnosis. For those already diagnosed and treated for colon cancer, CEA testing is valuable for monitoring treatment effectiveness and detecting recurrence. A decrease in CEA levels after surgery or chemotherapy usually indicates a good response, while rising levels during follow-up may signal a recurrence and the need for further evaluation. Regular CEA testing is often recommended during post-treatment surveillance. Lastly, it is essential to consult your healthcare provider about your elevated CEA levels. Since there are multiple potential causes and implications, a healthcare professional can guide you on the appropriate next steps tailored to your individual health status. Do not rely solely on CEA testing to diagnose or rule out colon cancer. It is just one part of a comprehensive diagnostic and monitoring approach. In summary, if your CEA test results are high, it is important to seek further medical evaluation to determine the underlying cause. This may include colon cancer, but also other benign or malignant conditions. Always follow up with your healthcare provider for personalized advice and any necessary further testing.